Piperacillin Tazobactum is one of the most common BLBLIs used in the ICU and probably the one which has the largest spectrum of action. And this is both because of piperacillin and Tazobactum. Tazobactum is among the broadest and the most reliable among first generation BLIs, the other being sulbactam and clovelinate. And piperacillin has a broadest spectrum among the extended penicillin group, including activity against Pseudomonas and anaerobes. It's also called an anti-pseudomonal penicillin. It has activity against ESBL, but in serious infections and those with blood culture positivity, carbapenem is preferred. So technically, when you have an ESBL, a BLBLI combination should be successful, but clinical trials have shown that when the patient is seriously sick, the outcomes are better with carbapenems, and that is why whenever we are said what is the drug of choice for ESBL bugs, it is actually a carbapenem. As a carbapenem sparing strategy, piperacillin tazobactam may be used even in the presence of ESBL in non-seriously ill patients, those with uncomplicated UTIs, but otherwise a carbapenem is a drug of choice. If we look at the indications for which we can use, it can be used for pneumonia, intra-abdominal infections, skin and soft tissue infections, urinary tract infections, and also it's one of the drugs which can be empirically used in the presence of febrile neutropenia. The CSF penetration of piperacillin tazobactam is poor, and so in clinical situations where we require high CSF concentration, this drug should be avoided. It has been used with aminoglycosides and quinolones for synergy, and this is something we will continue to explore even in coming times. It's a fairly safe antibiotic. So you have those issues of beta-lactam related antibiotics, GI upset, C. diff infection, but otherwise it's a fairly safe antibiotic. For Pseudomonas, it might be of use even in the presence of carbapenem resistance because of non-beta-lactamase mediated resistance. So there could be situations where a Pseudomonas is resistant to carbapenem but may show sensitivity to piperacillin tazobactam. As for AMP-C, which are elaborated by the class C Ambler classifications for beta-lactamases, although it does not induce the enzymes, it remains susceptible to hydrolysis. So it's not a drug of choice when there is elaboration of AMP-C. And among the BLBLIs, piperacillin is one which is the best spectrum and probably next in action to carbapenem. There is a lot of data where there is comparison of piperacillin tazobactam and carbapenem. What we need to understand is that when an ESBL is isolated as per the culture reports and the patient is seriously sick, at that point of time we should be using a carbapenem. Otherwise, piperacillin tazobactam is fairly comparable to carbapenem in its spectrum of activity, and one of the drugs which can be used as a carbapenem sparing strategy in the intensive care unit. The use of the drug empirically or after culture reports mainly depends on what kind of sensitivity the bugs show, but piperacillin tazobactam will continue to be an important drug in our armamentarium against bugs for seriously ill patients and for use in intensive care unit.